Okay, so you're at the point where you need to start an IV. If you aren't comfortable yet starting IVs, the most important thing to do is not to panic. If you're going to start an IV, you need to go in with a confident attitude, and this process will go a lot smoother. So you'll want to have all your supplies ready before jumping in. The supplies that you'll need are going to be gloves, a beveled needle with catheter, an IV start kit, which typically includes a Tegaderm patch, gauze, a skin prep cleaning agent, tape, and a tourniquet. You may also need a 10 milliliter saline flush, which can then be used to determine whether or not you're in the correct location and vein patency. You may also want to tear your tape into strips, so you'll be completely prepared for the end. To begin, you'll want to find a suitable vein. There are numerous veins that can be poked, but the most common veins will be on the upper extremity, mainly your antecubital fossa and the dorsum of the hand. There are a lot of different tricks that seasoned IV veterans use to make the veins bulge out, but a few of the more common ones are going to be asking the patient to clench and unclench their hand, 5 or 10 seconds. Another trick is going to be to have the patient hang their arm off down by their side for a few seconds to increase blood flow down to the hand. Some people prefer to tap a vein, which may help also reveal a good vein. So either of those techniques are what is commonly used out in practice. But don't be spending too long looking for a good site, since patients expect you to know what you're doing, even when you may not be a pro. So let's begin an IV start. To begin, you'll need to apply a tourniquet. There is no magic location on where to place the tourniquet, but as a rule of thumb, you want to apply it, about half an extremity proximal to the puncture location. So in this example, if you want to start an IV on the dorsum of the hand, then you'll want to tie off approximately at the middle of the forearm. Since we're going to be doing the antecubital fossa, just halfway up the humerus is going to be fine. I'll demonstrate one version of the tie of how to do that. So for this, you'll want to make sure that the tourniquet can be removed by one hand only. So to tie it, you'll be taking both sides, as demonstrated, and then crossing over, and then tie it off so that way the tourniquet can be removed by pulling just one side. There are great videos online, and we'll actually make a video later on how to do this. Our next step is going to be cleaning the site where you're going to be introducing the needle. This is to prevent any infection once you break the skin surface. So for our kit, we have a little prep kit. You'll just break the little tube inside and then prep this site where you're going to be injecting. So we have a vein found, and now you'll want to possibly anchor it. Veins do roll, so anchoring the vein will help you when inserting the needle. To do this, you'll want to grab with your non-dominant hand a few inches just distal to the vein, and with your thumb apply some traction to the skin. So you're dragging the skin away from that site. This helps reduce the number of rolled veins and will make you look like an IV pro. Now it's time to grab your needle and catheter. The most important thing is to remember bevel up. Now what do I mean by bevel up? Here we see a drawn in needle where we have the sharp pointy side at the bottom closest to the skin and a scoop or a hollow side up near the top. Bevel down just simply means you're putting that pointed needle side down as close to the skin as possible. Now what you'll do is you're going to be removing the tip, exposing the catheter and needle, and you'll want to figure out an angle to insert at. Typically, you don't want to insert the needle at a 45-degree angle because you're not digging for gold, you're digging for a vein. Veins run pretty superficial to the skin, so it won't take long before you encounter a vein. I typically hold the needle at about a 15-20 degree angle to the skin. Make sure you insert the needle in a nice and controlled fashion. Once you hit a vein, there will be a little flash chamber in the needle that will fill. And you can see that there is a little red in the flash chamber. This tells you that you have pierced the vein. If you're in the correct location, your next step is to advance the catheter from the needle. Make sure you don't move your needle hand, you're just moving the catheter. So don't move the needle, just move the catheter. This is the biggest tip. So we're simply sliding off that catheter from the tube, from the needle. Advance the catheter as far as it can go down into the vein and then remove the needle. Some needles, like this one, are spring-loaded and retract once the button is pressed. Now we need to be ready to stop the bleeding. As you can see, we apply pressure directly proximal to the site because this will prevent the backflow of blood through the hollow catheter. To slow this, you'll do two things. You can place pressure as shown and also remove the tourniquet. Next, what you'll want to do is you'll want to check the correct location of the catheter. So we're going to use a 10 milliliter saline flush. Now here, what we're doing is we're attaching the saline flush and checking the patency of the vein. If the saline easily moves into the skin, or into the vein, then we are in the correct location. If we see a wheal forming, which we do not, which would just be a tiny bubble underneath the skin, it would show us that our catheter tip is not in the correct location. But as you can see here, we have just injected 10 milliliters or 10 cc's of saline, and if it was not in the correct location, we would be able to tell. But however, it did go into the vein, so we are in the correct location. Now you can remove this and attach any further tubing as necessary, but for the sake of this video, we'll now show you how to remove a catheter. To remove the catheter, what you'll need to do is you'll need to get some gauze ready. We just have some 2x2 gauze pads. Now what you'll do is you'll apply some pressure just proximal to the catheter. Now you'll just remove the tubing by applying pressure with this thumb and removing the catheter slowly as shown. Now you can apply some pressure for about 5 to 10 seconds, apply a bandage, and then you are done. We'll tape it off just in the example shown, and that is how to start and remove an IV.
What I like to think of is my opposite hand is like my guiding arrow. So if I'm in the skin and I'm having trouble finding my vein again, this hand is free. You always want to have a working hand and a free hand if possible. As medics, we learn over time you only have one hand ever. So you got to do what you can with what you got. But if I'm having trouble, if I have my IV catheter here and I've lost my vein, I can use this opposite hand to go again and start feeling. And at that time I can redirect my needle using my arm as my needle. It's not just your hand. You are an extension of that needle. If your patient is facing straight on, you should be facing straight on. If they're at an angle like this, you should be at an angle. You always want to be moving with your patient, not reaching over your patient, reaching over your hand. That not only will overextend you, but can cause pain to your patient or can set yourself up for accidental sticks, which you don't want. So this is the bevel of the catheter, this small sliced out piece. This is the part that's going to give you the flash once you enter the vein. Seeing as how that the catheter is set back from the end of the bevel, when you initially get a flash, that's just this small part at the end receiving blood into it. That is why when we poke our patients, once we get a flash, we flatten our IV needle out and then advance it forward a little bit so that it's setting back onto the catheter. That bevel is creating an opening in the vein for the catheter, when you watch, to slide over the end of the needle. Here's the tip. So let's say you get underneath the skin and, oh my goodness, you lost your vein. We need to re-find it. Instead of digging around or what we call fishing, I have a quick tip to show you how to redirect your needle and not cause your patient a lot of pain. Okay? So let's say we've poked and we're underneath the skin and oh, our vein is all the way over here. Instead of with half of your needle in and moving it to the side, looking at that, think about how much skin and tissue you're shearing and how much pain you're causing your patient. That's called fishing. What we want to do is you want to draw the needle back until it's almost out of the surface of the skin, and then move your hand to redirect and then go back in. If we need to move again, pull back, almost out, and then redirect your hand again and go forward to find the vein. Press forward, oh, we got a flash, then we can go ahead, flatten out, move forward, and then catheterize. Pull out, and this is where we would tamponade. No fishing. So we also want to talk about the ways that you can find a vein, ways that you can feel a vein. There are 3 ways that are the best, that are the most beneficial. The 3 types of veins that we're looking for when we're trying to find an appropriate spot are ranked in order. The first type are ones that we can not only see, but we can also feel. And by feel, I mean when you cross over a vein, there is a soft squish or bounce that you can feel. Try and use your most sensitive finger and use that finger every single time. So our first choice would be one that we can see and feel. Our second choice would be one that we can't see, but we can feel. So when you start moving across the arm, you start to feel a squish in the arm, and you can start feeling that circumference and that bounce back, that squish of the vein. Third type of vein that we would prefer, and our last choice, basically, of what we would like, is one that we can see but not feel. And those tend to be wrist veins or anything really in the forearm. Those are kind of our last ditch effort if we can't see anything else, and they tend to be smaller catheter size, such as a 22 or even a 24. So ones that we can see and feel, ones that we can't see but we can feel, and then ones that we can see but not feel. The more obese your patient may happen to be, you need to push a little bit harder because you have more tissue to pass through. So usually it will be not just right under the surface, but maybe a little bit deeper. But we also want to think about how thick skin is. Skin is not very thick. So we don't need to go at some crazy angle in on our needle. It's basically just to get under the skin and to poke quick, hard, and fast. Once we are in, those nerve endings are at the skin level and also surrounding the vein. So usually once you get into the skin, we shouldn't be causing a lot of pain to our patients once we're in the skin. And at that time, we can readjust a little bit. Sometimes veins that we can not see, but we can feel, sometimes we lose them after cleaning. So before you clean the site, you can use anything that happens to have any kind of depression in it. What you can do is lightly press it up against the skin, rotate back and forth where you found the best place to poke your patient. When you remove that, you'll have a small raised area that you can clean, and it will still stay there, and you can use that as a target to aim your way. So direction of vein is also very important. Not everyone's veins run up and down like the center vein does. Sometimes they run at an angle such as this. At that time, you want to make sure that you are appropriately aiming your catheter, whether you're aiming here at an angle or here straight forward. We also want to make sure that we have enough of that vein available to us for the catheter to sit in. So you always want to feel where your vein starts and follow up your vein, feeling where it ends. You always want to start your IV at the point where your vein starts, so you can make sure you have enough room for your catheter to sit in, and therefore your IV is more effective and less likely to slip out. And some veins also cannot be straight, just like this one is or this one is. Sometimes they're set at squiggles. So what we want to do is start at the bottom and try and hold taut as much pressure to try and straighten out the vein the best that we can. When you have a hand, you want to start your tourniquet usually down here, not too close, just a little bit further away. Now, hand veins are very surface. You don't need to go at very steep of an angle to find your vein. Also, they're bony and they have a lot of nerve endings in them, so it's more painful for the patient. There's a few ways you can hold the hand. You can either have the patient just hold your hand like this, or you can kind of curl the hand under. And it's always a good idea to angle down so that you can come up at the vein at a more straight and on the same plane as the hand itself. So we're starting at an angle, get our flash, and this is what a flash looks like here. Flatten and move forward. Then advance our catheter. Pull our needle out slightly while putting tamponade on the patient and removing our needle and slam dunk into our sharps.